Hello, my name is Damaris Fierro and I'm going to talk about cardiovascular diseases. Definition: cardiovascular diseases, CVD, also called heart disease or coronary heart disease, are disorders of the heart and blood vessels. Arteriosclerosis is one of the main triggers. It occurs when the walls of the arteries accumulate cholesterol, plaques, lipids, fats, and inflammatory cells, which can obstruct the arteries and impede blood circulation, resulting in the circulation of blood leading to an accident or cardiovascular event. We speak of cardiovascular diseases when, for example, there is a lack of blood supplies to the heart muscle and angina pectoris developed and angina pectoris or myocardial infarction develops. Also, when a person is born with a congenital heart disease, malformation of the heart, or when this organ does not have enough capacity to pump blood to the heart muscle, is not capable of pumping blood and heart failure occurs. It can even happen that the heart beats irregularly and atrial fibrillation, the most frequent arrhythmia, develops.
Cardiovascular disease involves abnormalities of the heart and blood vessels. Coronary heart disease is the most common condition and is the leading cause of death in the United States for both men and women. The lifetime risk for developing significant cardiovascular disease is greater than the likelihood of developing cancer. Your heart is a muscular pump that requires heart arteries to supply oxygen-rich blood to keep it going. Coronary heart disease occurs when these blood vessels become narrowed due to a buildup of plaque. The plaque is made up of cholesterol and other substances. This process is called atherosclerosis. Atherosclerosis occurs over a lifetime and is influenced by risk factors. Some risk factors can't be changed. However, others can be altered through healthy lifestyle choices and medications if needed. Symptoms of coronary heart disease occur when the heart muscle does not get enough oxygen. Some describe this as chest pressure or chest pain that starts over the left chest and can radiate or travel to the left arm, left jaw, back, or sometimes to the right chest. Some patients do not have any chest pain or pressure symptoms, but instead have intense shortness of breath or epigastric discomfort that can feel like a bad heartburn. Breathlessness, nausea, vomiting, or sweats can also sometimes be associated. These symptoms are called angina. There are many treatments for angina, including medications, angioplasty and stents, and bypass surgery. Aggressive risk factor modification is part of every treatment plan. Coronary heart disease can have serious complications, including heart attacks and even sudden death. Fortunately, developing significant coronary heart disease is largely preventable. Early prevention is best, but you can still improve how you'll do, no matter how old you are, by reducing your risk factors. One study found that 50-year-old people who had not already developed significant cardiovascular disease and didn't have major risk factors reduced their lifetime risk for developing significant cardiovascular disease, and they live longer. Continue on through this section to learn more.
Application in medicine. Routine mammograms can provide key information about cardiovascular disease. The detection of arterial calcifications of breast mammograms was associated with an increased risk of cardiovascular disease in postmenopausal women, according to new research published in Circulation Cardiovascular Imaging, a peer-reviewed journal of the American Heart Association. Mammograms can provide clues to cardiovascular disease risk. According to the study authors, these findings could be useful in determining women's risk of heart disease and stroke, breast arterial calcification, the buildup of calcium in the middle layer of the arteriole was to the breast in associated with aging, type 2 diabetes, hypertension, and inflammation, and is a marker of artery stiffness.
Now, another topic that we talk about on the show quite a bit, mammograms are best known to help find breast cancer, but as it turns out, this important test may have a way of preventing heart attack and strokes in millions of women. How? A study was done. It involved 292 women. They underwent digital mammography. They then found, and the researchers did, that 70% of the women who showed evidence of breast arterial calcification also had coronary arterial calcification. And that, of course, is a marker for heart disease. We talk about calcification in heart disease. Right. This is interesting. A lot of people don't understand mammograms, but this does make sense.
Exactly. So, and this isn't the first, there are over 25 studies looking for the association between breast artery calcifications, saying, hey, well, if those arteries have atherosclerotic plaque, why wouldn't your coronaries, which could lead to heart attack, or your carotids leading to a stroke?
Right, exactly. Your peripheral vascular system as well.
Right. And so it turns out, if you look at this photo, that little spidery kind of spaghetti that has calcium in the red circle there, that's an artery, and it has plaque inside of it. And as this study showed, up to 70% of women will also have then higher risk for coronary artery disease and stroke risk. So of all those 25 studies, not every one shows a strong association, but definitely when I see that, I can predict that when I look at that lady's list of meds, she's got hypertension, diabetes, it really goes hand in hand.
And where it could come in handy is if you're a woman, you're going in for your mammogram, you have no idea your risk for heart disease, and you see all these calcifications, you know, then you get that, and you know that you got to monitor this.
Investigate. Combine it with a good history. Is there a family history of heart disease? And like you said, the other things, predisposing factors, high blood pressure, high cholesterol, overweight, smoking, all those other things. If they're going on, then you need to investigate further.
You modify risk factors.
So do you see this study saving money?
Saving money because, well, and saving lives. Consider this, 292,000 women die from heart attacks every single year. Yeah. 40,000 die from breast cancer. So you're over.
So the number one killer.
7 times more likely. Yeah, it's the number one killer. So you're already getting your mammogram every year. So if you have some radiologist who's in tune to the fact that your health care is incomplete, you've got this high-risk mammogram, maybe we should look at your heart as well.
And for women, heart disease presents totally different. You know, it's not, typically they have a heart attack. It's not the classic heart attack that men have. For a lot of women, they're asymptomatic until it's too late.
Well, the beauty of heart disease risk, and these calcifications increase your risk for a heart attack. And I think one of the biggest things, I always talk about food is medicine, and we don't always have to manage these things purely medically. We don't necessarily have to take someone who's at increased risk and add 5,000 new medications. Sometimes it's just that wake-up call, you know, like, hey, it's time to enjoy more craft beers and red wine. No, I'm kidding. But you got to pay attention to lifestyle, increase your activity, the food, improve the foods you eat. Because the one danger in this, we know in the world of false positives, the last thing you want is now, you know, every single woman who gets a mammogram is then going in for a coronary angiogram. It's always that fine line, right?
About 12% of women will have that look of their vessels on a mammogram. And so in this particular study, of the 12%, 70% of those women are going to have some sort of cardiovascular disease.
Do you do mammograms earlier then? Do you start them earlier?
The calcifications do take time to develop, and they're really found in the majority of postmenopausal women. And diabetes is a real risk factor for this.
I mean, this is a truly fascinating study.
Pros and cons. Pros. Healthy eating and physical activity. Consume fresh and varied foods, including whole fruits and vegetables at each meal. Consumption of tobacco and alcoholic beverages. Avoid consumption of tobacco and its derivatives, as well as exposure to smoke from these products. managing stress, hypertension, and diabetes, learning to manage problems as well as controlling blood pressure and blood sugar levels, improve overall health and heart health. Cons: high blood pressure, hypertension. High blood pressure increases the risk of heart disease, heart attack, and stroke. Diabetes. Heart problems are the leading cause of death among diabetic, especially those with adult onset or type 2 diabetes. Obesity and overweight. Excess weight can raise cholesterol and cause high blood pressure and diabetes. All of these are major risk factors for heart disease. Heredity. Heart disease often runs in families. For example, if parents or siblings had a heart or circulatory problem before the age of 55, the person has a higher cardiovascular risk than some who does not have such a family history.
This video is a presentation of the National Heart, Lung, and Blood Institute. The Heart Truth. Heart disease risk factors.
We know that if women take care of their hearts and are aware of their risk, they can reduce their chances of developing coronary artery disease. Some of the risk factors that you can control are smoking, high blood pressure, high cholesterol, and high triglyceride levels, diabetes and prediabetes, being overweight or obese, being physically inactive, or having metabolic syndrome. The risk factors you can't control include having a family history of early heart disease, being over the age of 55, or having had a history of preeclampsia.
Heart health is important at all ages. Having just one risk factor can double your chance of developing heart disease. 2 risk factors can quadruple your risk, while having 3 or more risk factors increases your risk for heart disease more than 10-fold. Prevention is key. Here are some steps you can take to improve your heart health. Don't smoke, and if you do, quit. Aim for a healthy weight. Overweight and obesity cause many preventable deaths. Get moving. Try for 30 minutes of moderate intensity activity a day. Eat for heart health. Choose a diet low in saturated fat, trans fat, and cholesterol. Eat plenty of fruits, vegetables, whole grains, and fat-free or low-fat milk products. Know your numbers. Ask your doctor to check your blood pressure, cholesterol, and blood glucose. Work with your doctor to improve any numbers that are not normal. Know your family's medical history. Because the heart truth starts with you. For more information, visit www.hearttruth.gov. The Heart Truth. Brought to you by the U.S. Department of Health and Human Services, National Institutes of Health, National Heart, Lung, and Blood Institute.
Issues applied in Ecuador. In Ecuador, cardiovascular diseases are the leading cause of death, reaching 26.49% of all deaths in 2019. According to the 2018 STEPS survey, 25.8% of the population between 18 and 69 years present 3 or more risk factors of chronic non-communicable diseases. Among those with the highest incidence are high blood pressure, hyperglycemia, altered glucose, and high cholesterol. Conclusion. In conclusion, it is necessary to have a good diet and exercise habits to avoid contracting this type of disease, since cardiovascular diseases are a public health problem worldwide and are also the leading cause of mortality in the world. Thank you.